Tara Lopez joins us now. Tara, this morning you're going to be sharing some potentially life-saving information from the Heart and Stroke Foundation.
Yes, Nicole and Catherine, we are going to be speaking with not only the director of the Heart and Stroke Foundation later on this morning, as we did hear from her earlier on, but we're also going to be speaking with some survivors. Ken and Evelyn are from Steinbach, and they actually suffered a stroke. Well, Ken did back in January, so he's going to be sharing his fascinating story of survival. We're also going to be speaking with a radiologist this hour, talking about some of the life-saving treatments when it comes to strokes. The latest technology called EVT, find out what that is. And coming up at around 8 in the hour, we're going to be speaking with a doctor touching on things such as virtual health and something called telestroke. Find out what all of those are right here on CTV Morning Live.
Very important, and as Nicole mentioned, life-saving information. We look forward to hearing more of that.
The Heart and Stroke Foundation does amazing work here in Manitoba and across Canada. They've been doing this for over 60 years, so we're very thankful that they were able to line up today's interview. They're with some stroke survivors. Joining us today on CTV Morning Live, Ken and Evelyn Payton from Steinbach. Thank you so much for being here.
Good morning.
Good morning. So, Ken, you survived a stroke earlier this year in January. Can you tell us about that experience?
Yes, I woke up at 1 o'clock in the morning. Well, I didn't really wake up. I was couldn't speak, and my right leg and arm were paralyzed, and I was trying to get up, and Evelyn thought I was dreaming, so she was trying to wake me up, and I couldn't speak to her. So, and she called the ambulance from there. And then after that, I'm not sure what happened because I was en route, so maybe she could share that.
Yeah, we went to the Bethesda Hospital and they gave him the drugs and sent him to Health Sciences Center, and they took out the clot.
Now, Evelyn, did you know that he was having a stroke when all of this was happening?
No, I did not. I didn't know what it was, but I knew I needed to call somebody right away.
And that's good that you did. Mm-hmm.
Yeah, very glad.
Now, for people in the future that may encounter something like this with their friends or family, could you possibly tell us some of the signs that they could be on the lookout for when it comes to having a stroke?
Well, he didn't speak. He couldn't speak for one thing, and his arm was his right side. He couldn't move on it. He couldn't lean on it. So it was, a couple of good signs.
My eyes couldn't look anywhere but the left.
And Ken, can you tell us about your recovery process and about how the medical teams here in Manitoba were able to help?
It was fairly quick, I thought, knowing what other people have gone through. I was in the hospital for 10 days and walked out, and the hospital staff were great, from Bethesda to Health Science. I was physio for a little bit, and then I've been progressively getting better and better. But back to doing normal things like driving and cutting the grass and working on things. So I feel pretty blessed. And I was very happy that Evelyn didn't get up and go to the next room because she thought I was dreaming. So that wouldn't have been very good for me.
Thank you so much for sharing your story of survival. We really appreciate it. And coming up next hour, we're going to be speaking with some radiologists on some life-saving technology. For more information, you can head to heartandstroke.ca. All morning long, we have been talking about the great work of the Heart and Stroke Foundation. And joining us now on CTV Morning Live is Dr. J.J. Shankar. He is a radiologist. I guess we should call him an neurointerventional radiologist, should we say, here in the province. Good morning, Dr. Shankar, for joining us today.
Good morning, Tara.
All right, can you talk about, some of the amazing technology, life-saving technology that has been, happening here in the province when it comes to heart and stroke health, such as EVT?
Yeah. Endovascular ectomy is a relatively new technology. It has been around for quite some time, but the evidence for this came only in 2015, and more evidence is coming along. And this is a technology, in a general term, you can call it clot retrieval. We go through inside the blood vessel and get to the clot in the brain through inside the blood vessel and deploy a fishnet or stent, you can call it, and pull the clot out. So anything that is blocked, once you open it, it works. And that's what endovascular thrombectomy is.
Also known as EVT for short. Now we're hearing, Dr. Shankar, that for every minute that passes when somebody has a stroke, about 2 million brain cells die. Is this true?
That is very, very true. And that also translates to that time is of essence. So time, you save time by whatever means, you can save more brain cells and more of a person. So time is very, very critical in stroke treatment.
Thank you so much for sharing all this valuable information. And later on throughout the show, we're going to be talking about how you can get that very time-sensitive treatment right here in Manitoba when it comes to having a stroke. And you can learn more information about all these topics at heartandstroke.ca. Today, we've been talking about some of the fabulous work that has been done by the Heart and Stroke Foundation of Manitoba. Joining us today here on CTV Morning Live is a medical doctor who is also the VP of Medical Services at Southern Health. That is Dr. Dene Fortier. Thank you so much for joining us today.
Thank you for having me.
Now, we wanted to talk about virtual medicine and specifically something called telestroke. Can you tell us about that?
Right. So telestroke is about coming into the hospital, one of the local hospitals, through EMS, and then having some video conferencing or teleconferencing with a neurologist in Winnipeg. So basically, we're bringing the specialty to you closer to home, and it uses the two things. It uses CT scans, which is an important piece of this this component, this telestroke process, and it also involves a neurologist. So you need those two things for it to work. Historically, it's always been you had to go to Winnipeg to get all of that package, but since about 2014, we started rolling this out into rural Manitoba, whereby people with possible strokes have access to CT scan imaging and a neurologist through video conferencing, and then they determine with the physician what kind of treatment is required.
And there are about 7 rural communities in Manitoba with telestroke now, right?
That is correct. There's 2 in the north, Thompson and Dauphin, Thompson and Nepaw. There's 2 in Prairie Mountain, Dauphin and Brandon, and then there's 3 in our region, in Portage, Boundary Trails, and Bethesda and Steinbach.
Now, when it comes to accessing telestroke, is this just at the hospital? Do people need to have any sort of technology on their own in order to access this service?
No, basically the only technology you need is some way to access 911 and emergency response services. And once you do that, and you should do that as quickly as possible if you have any suspicion, then the system takes care of you. It takes you to the closest site, one of those 7 rural sites, or Winnipeg if you're close to Winnipeg. And from there, the system gets going. You have an assessment, you have a CT scan immediately, and you have a consultation with a neurologist to determine the best course of action.
Dr. Dene Fortier, thank you so much for speaking with us this morning about telestroke, and we'll be talking more about the Heart and Stroke Foundation and some of their fabulous work here in Manitoba coming up later in the show.
Let's check in one last time with our Tara Lopez. Tara, you've been sharing some vital information with us from the Heart and Stroke Foundation on how to keep people safe should they be experiencing an emergency.
Yes, we have talked to everyone from stroke survivors to radiologists to doctors, and joining us yet again here on CTV Morning Live, we welcome back the director for media relations, as well as health promotions and government relations. Thank you so much, Christine Hood, for joining us yet again here on CTV Morning Live. And we just wanted to talk about this time people who are at risk for strokes and heart attacks. Could you tell us about that?
Sure. So when it comes to stroke, we know that age is certainly a risk factor. 80% of strokes that happen do happen in people over the age of 60. But we are seeing that age group of 20 to 59, there's an increase in strokes happening there as well. So 19% of strokes that we see are in that younger age category. And we'd see that in those individuals as well, it seems to be taking them longer to get to the hospital. So that's certainly of concern. So we certainly want to make sure that anybody at any age who's experiencing a stroke acts fast and calls 911. As far as other risks for stroke, certainly, smoking, unhealthy eating, physical inactivity are important risk factors. But the number one risk factor for stroke is high blood pressure. So again, super important that people know what their blood pressure is and that they work with their health provider to ensure that that blood pressure number is within a healthy range.
Can we touch on the signs of having a stroke yet again, fast?
Yes, absolutely. Again, those signs of stroke are critical. So we use the acronym FAST. Face, is it drooping? Arms, can you raise both? Speech, is it jumbled or slurred? And T stands for time to call 911 right away. And again, accessing 911 so that we can access this great system that Dr. Fortier was talking about, these great interventions that Dr. Shankar was talking about, is really critical for Manitobans.
And our final question for you this morning, what are some things that people can do in order to prevent having a stroke or heart attack?
Again, keeping track of those risk factors, knowing what your blood pressure is, eating healthy, being physically active, being smoke-free, and just, being aware of what those signs are so that if something does occur for yourself or in a loved one, you're able to act fast and access treatment.
Christine Hood, she is the Director of Government Relations and Health Promotion at the Heart and Stroke Foundation of Manitoba. Thank you so much for joining us this morning. And if you want to learn more information about how you can prevent having a stroke or heart attack in your life and in the lives of your loved ones, check out this website. That is heartandstroke.ca.
Thanks for that information this morning, Tara.